I'm Dr. James Galvin, a professor of neurology at the University of Miami Miller School of Medicine and director of the Comprehensive Center for Brain Health. As a cognitive neurologist, my interest is in exploring healthy brain aging and neurodegenerative diseases such as Alzheimer's disease and Parkinson's disease. I'm an experienced investigator, published over 275 original scientific papers, 25 book chapters, and 3 textbooks. I have 11 patents and copyrights on dementia screening instruments and the principal investigator for 7 National Institutes of Health studies. So when I first met Dr. Tony, I found him a very engaging and interesting individual, and you could say he's quite the character, and I mean that in a good way. You could tell right away that he deeply cared about his patients, and he really believed that acupuncture could provide a therapeutic benefit for a number of conditions, including mild cognitive impairment and dementia. I think what impressed me about Dr. Tony was not just he was simply a practitioner, is that he was also engaged in learning about the science and going for his PhD. So he was providing care for his patients, but also studying to understand more about what the practice he's doing may be offering in terms of the benefits. So when Dr. Tony approached me about the possibility of using acupuncture, I was intrigued. I went back and looked at the literature, and there are some studies looking at acupuncture for the treatment in mild cognitive impairment and Alzheimer's disease, almost exclusively done in China. And most of these publications are in Chinese journals, so they have limited availability in English. There really hasn't been a lot done in the United States looking at acupuncture for this particular disorder, mild cognitive impairment and Alzheimer's disease. So I was intrigued as to whether we would be able to design a study that would help us explore this question. For what was available, it appeared that people who had mild cognitive impairment who had acupuncture showed some improvement in their memory. Now, the traditional medicines that we use actually offer very little benefit in terms of improvement. Most of the benefit for the medicine, which is modest in nature, is to try to slow down the decline of memory without showing much in the way of improvement. So if we could somehow enhance that by offering additional therapeutic approaches, I thought that would be a home run. The patients all really enjoyed working with them, and they all had high satisfaction with the study. Matter of fact, many of them wanted to continue acupuncture after the study was over. So when we decided to do the study, he was instrumental in helping design the correct acupoints that we were going to use and understanding the meridians, much more than I understand. So as a neurologist, I was very interested in what might be the underlying biology of acupuncture. So I went back and I read a little bit about what acupuncture science is about, and tapping into the meridians and the different points. And a study done in China had using functional MRI. And so the difference between functional MRI and the clinical MRIs that people get for diagnosis is those MRIs are looking at structure, so the size and shape of things. Functional MRI looks at the connection between different parts of the brain and whether a procedure or an intervention could alter this. And so in some of the literature, it suggested that placing the needle in the correct meridian actually gave signals in the brain suggesting improved connectivity, improved connections. And this would be important in a neurodegenerative disease where the brain is losing connections. As a neuroscientist, my thought would be that introducing the needle might trigger a release of chemicals throughout the nervous system. So endorphin-like chemicals. So these are chemicals that give us a sense of euphoria and can give us some pain relief. And these things are often manipulated through osteopathic medicine, through chiropractic, through other techniques to relieve pain. But they might have other actions in different parts of the brain. And so if we could somehow trigger the release of these chemicals, we might be able to afford an effect. So this was my underlying hypothesis about what we might be doing. Now, we didn't specifically test this. We didn't measure these chemicals at this point. But the idea was, is there enough of a scientific basis to warrant doing a study? And I believe there was. So we went ahead and did the study. And in fact, we demonstrated a clinical benefit. Knowing that we demonstrated the clinical benefit gives us evidence to pursue this further as a potential treatment option for people with mild cognitive impairment and dementia. So when we designed the study, we wanted to think about what outcomes would be relevant that we could capture. Reviewing the literature, most studies with acupuncture had looked at some physical aspects, so people with chronic pain or other physical limitations. So we wanted to be able to capture some of that. So some of the outcomes we captured were on physical performance, balance, walking, gait, strength. And then we wanted to capture outcomes that were specific for diseases like mild cognitive impairment. So we wanted to capture a cognitive outcome, a quality of life outcome, and a mood outcome, because these things are relevant to that particular disease. And so we designed the study. It was an open label study, so everybody got acupuncture. And so we measured people before the study began, midway through the study, and then at the end of the study. So 3 time measurements. So time 1 was before the study started, time 2 was midpoint of the 8-week study, and time 3 was after the 8-week study was completed. And then we compared whether there were changes in physical functionality, mood, quality of life, and cognition. And the first part is we found that people improved in their physical performance, their balance, and their walking. And this was important because this helped verify that when we did the study, we had outcomes that were similar to other outcomes collected in other acupuncture studies. So that was very important for sort of internal validation. But what was very rewarding was that we saw that people reported improved quality of life, improved mood, and in fact showed improvement in their cognitive scores over the course of the 8-week study. And this is important again because typically with a disease like mild cognitive impairment due to Alzheimer's disease, the expectation is over time people's scores would get worse. Now we only did the study for 8 weeks, so we don't expect a lot of decline, but we don't expect any improvement in the normal settings. And what we found was their scores actually showed some improvement. So we believe that the acupuncture had a positive effect on cognition, mood, quality of life, as well as having a positive effect on their physical performance. And so we think that this provides us with the necessary evidence to design and go to do a larger study. That would be a true placebo-controlled study. That is, one group would get acupuncture and one group would get a placebo or sham acupuncture. So they would undergo the procedure, but the points would be placed just outside the meridian, so they should not get the benefit of the acupuncture process. And ultimately, this will allow us to have an independent study confirming our results from the first study. To the best of my knowledge, the study that we did was the first that was done at our university at the time, and I think probably one of the first done in the United States, and one of the first published in a primarily English journal. So our research and the research of others has suggested that there are really multiple pathways that someone might develop a disease like Alzheimer's disease. But that also tells us that there are really multiple pathways to approach the disease. There are really multiple ways that we can provide treatments, cures, develop prevention strategies, and I believe that that's going to require a combination of traditional Western medicine approaches with medications, as well as complementary and alternative approaches that take into account person's lifestyle, their belief systems, diet, exercise, health behaviors, risk reduction, and I think that there's also a place for things like acupuncture. And I think that when we come to take care of our patients, and ultimately as a physician, that's what I do, I care for people. I want to have as many tools as possible in my bag that I can offer my patients. And I believe it's more than just, here, take this medicine and call me in 6 months. I think it's how can we make you the best you that you can be. And I think that acupuncture is part of that toolkit that we can provide for our patients.